We look at the evidence, we look at the data. So one, where's the burden? Two, what is killing people? And so really looking at the mortality that is, you can look at the global health estimates that give the ranking of public health issues, and most of those are non-communicable diseases. We also look at what can be measured. Mike always says if you can't measure it, you can't manage it. And so we want to make sure that we're supporting public health issues that can be managed, because that helps guide our strategy. And we also aren't afraid to take on things that no one else is funding. When we first started funding, say, road safety or tobacco control, there are very few funders in that field, and we've seen it grow. But really, we want to use the data, and we want to ensure that there's evidence-based policies that can support the work, and that there are strong partners that can actually implement the work. So there's a lot of criteria to look at, but it's a formula that works very well. And we know that we're saving lives through our public health events.
So we're talking about a lot of like macro scale change here. What are some of the biggest challenges that you all see when you're implementing these proven evidence-based public health interventions?
Well, there are a few things. When you think about political will, if you have leadership at the top that aren't invested in these public health issues, then it's going to be very hard to get things off the ground. So for us, we're always looking to partner with the highest level of the political chain, whether it be mayor or even ministries of health, making sure that there is a commitment to support the work that we are actually funding. And then another challenge would also just be resources. Their resources are often limited, and so really putting or ensuring that leaders are aware of the data and the opportunities to address some of the leading killers is important, and then providing at least startup resources to really demonstrate what can be done where we're working.
And shifting a little bit here, some of the cities in the partnership, well, I think you'll give them a selection of 15 interventions that they can use to tackle non-communicable diseases and injuries. Can you share an example of a city that successfully implemented one of these interventions?
Yes, sure. So we have, as you said, 15 interventions, basically about 6 policy areas, and they include tobacco control, road safety. We just recently added heat as a policy area. There's food policy, surveillance, and overdose prevention. And so cities select from those policy areas and identify an activity that they would want to support. So for tobacco control, I'll just talk about Bengaluru, India. They received an award from us in 2023 for their work on tobacco control and banning hookah. And so they received this award. They've been working, for quite a long time to ban hookah. The person that actually received the award was promoted to a state level position. And then kind of he was able to make the state ban hookah within the state. So that kind of example of taking on this policy, then working to scale it and expand it, that's just a great example in India.
And what are some of the factors when you're looking across cities that determine whether an intervention is successful? And maybe what are some of those common barriers as well?
So I mentioned the political will. So really requiring political will, and every city that is part of this network has a commitment from the mayor or the highest level political person within that city to support work within partnership. I think also ensuring that the city technical teams have the capacity and understanding of what is required to have these policies passed or interventions implemented. And that's where our partners really come in and are essential. That's Vital Strategies that is supporting the cities. They have teams all over the different regions. And so they provide technical guidance and capacity as well as the World Health Organization, that is another partner of ours.
And what does technical assistance in this regards look like?
That's a very good question. I mean, it's very broad. It could be, training teams on best practice or implementation or community engagement, communications. So it's providing them with some technical skills that will allow them to implement their programs. And so that's something that we provide. So it's the trainings, but it's also networking with other cities, and they can, share their technical understanding of the work. And then it is also could just be one-on-one. We have regional managers that work with all of the cities, and it's them helping the cities, weed through the processes that are required for them to implement the work.
And considering once again that you all have worked with this like large cohort of leaders and cities, what advice would you give to city leaders out there who want to prioritize non-communicable diseases and injury prevention, but maybe they lack the resources or the political backing?
Well, one, it's always communicating about the burden, so helping to understand what the issues are within the city. Two, getting that political will and making sure that that's supported at the highest levels of government. Resources, it's always challenging in some of the low and middle income cities because resources are somewhat scarce. So doing what you can with what you have with the hopes of demonstrating the positive aspects of the work and potential, upping of the commitment by the city.